I'm Kirsty. I'm going to be demonstrating a subcutaneous heparin injection, drawing up from an ampule. I'm going to start by doing hand hygiene and checking the 6 rights. I'm going to make sure I have the right patient, which is skip rocker, the right drug, which is heparin, the right dose. I'm going to do 0.5 milliliters. They want 5,000 units of a subcutaneous injection every 12 hours, and there is 10,000 units per milliliter, so I'm going to do half of a milliliter. I'm going to do the right time, which is now. I'm going to do the right route, which is subcutaneous, and then I'm going to document after I give the injection. I'm going to check the doctor's orders in the MAR, and now I'm going to prepare the injection. I'm going to start by looking at the ampule, making sure that it is not expired, there's no particulates in it. I'm going to make sure all of the medication is out of the top, which it is. And I'm going to use this gauze pad to open the ampule so that I do not cut myself. I'm going to pull the ampule towards myself so that it shatters away from me. I'm going to draw the medication up with a filter straw to make sure that I don't have any glass pieces in the medication. So I'm going to draw 0.5 milliliters of the medication and then 2 milliliters of air to lock the heparin in after I give the injection. And discard of everything in the sharps container. I'm going to replace the filter straw with the needle, and now I'm going to the patient's room to give him the injection. Hi, can you give me your name and date of birth? So this is Skip Rocker. His birthday is 1/1/1972. Those are his 2 identifiers. I'm going to tell the patient that I'm going to give him his injection subcutaneously in the abdomen, at least 2 inches away from his belly button. I'm going to perform hand hygiene. And put on a pair of gloves. I'm going to have the patient lay down, and I'm going to clean the area from inside to outside, making sure I don't go over any areas that I've already gone over. I'm going to make sure that the air is in the end of the syringe so that it locks the medication in. I'm going to squeeze his skin, and you might feel a little bit of a sting. 1, 2, 3. Discard of the needle. Blot if there's any blood, which there is not. Ask the patient if he's comfortable, get him back into a comfortable position, leave him his call light, and sign my documentation. And that is everything.